Okay, good morning, good afternoon. I don't know what time it is that you're watching this, but I would like to personally introduce myself. My name is Victoria Kaysen. I have been a nurse for 19, almost 20 years, a nurse practitioner for going on 7 years, and I completed my doctorate about a year and a half ago and ventured into the exciting world of nursing education about a year ago. Presentation I'm going to give you today is an integrative review regarding increasing statin adherence in primary care through the utilization of patient education and the Moriski medication adherence scale number 8. I, as the author, have no conflict of interest to report. I would like to thank you for the opportunity to allow me to present this information to you and taking your valuable time to participate in this presentation. I call this presentation Stop the Stopping of Statins because that's what we want to do ultimately, is to stop the non-adherence to statin medications with our cardiovascular patients. So the purpose of this is I worked in a rural primary care clinic for approximately 5 years prior to starting my current endeavor into the world of academia. But while medication adherence is a very well-known problem that we see, the majority of our patients that we see in the clinic, that they do have some form of cardiovascular disease, or they are on statin medications, again, to protect their cardiovascular system. We know as healthcare providers that cardiovascular disease is the #1 global killer. So not only are we, and our best treatment for this is statin medications, still baseline therapy. But it is, even though that we know this is effective therapy, we know it works, it's a known problem of maintaining adherence to the medications, but the purpose is to determine if we were to use a medication adherence tool in combination with nurse-led education regarding the medication itself and lifestyle modifications, can we increase adherence to statin therapy in these cardiovascular disease patients? Multiple studies have been performed on diverse interventions to increase statin compliance. However, there is no accord on the most appropriate intervention to promote success. So again, we know that this is a problem. Evidence in primary care practice is in alliance with the established trend of very poor adherence to statin therapy over the first year of treatment. So even within the first year of therapy, the patients are not remaining compliant to the medication. Not only that, as treatment continues, this is something that we know that they have to stay on long term, a lot of the time for the rest of their life, that as they continue to be on the medication, compliance has a tendency to decrease. Patient adherence to medication therapy targeted at the improvement of cardiovascular disease in the outpatient setting, this remains a challenge to healthcare system on a global level. So this is not just an issue that we're seeing here in our local state or even in our nation. This is a global issue. And again, we know these things work. So we know this medication works if you take it. So how can we address this global issue of non-adherence to statin medications? So you're asking yourself, what can we do? What do we do? There is no consensus on a successful approach to remedy this issue, hence my reason to kind of delve into this a little bit further. The first step is we need to determine why the patient is not adherent to their medication before we can determine the best course of action to remedy the medication non-adherence. So let's start here with this initial step. Let's start by using this tool. And in this case, we're talking about the Moriski Medication Adherence Screening Tool version number 8. This is an 8-question questionnaire that you can give to your patient. And this tool has been proven consistent in the outpatient clinical settings with very successful reproducibility. Now, giving your patient questionnaires regarding screening, this is not a new endeavor. We give questionnaires to our patients regarding their anxiety and their depression. This particular questionnaire, the MMAS-8, is simple in format and would probably be best conducted as we conduct our PHQ-9 or GAD-7 screenings. The important thing to keep in mind is that a lot of the time patients will try to answer these questions in the direction that of what they think you want to hear, and not necessarily be so honest. So that what I have found in my practice, that a lot of the time it is best to give them the questionnaire in a printed format. Say, I'm going to give you a couple minutes to fill this out. I'm going to step out, or have the nurse give it to them when they check in. After we review with the medication list with the patient, that's one thing that we do with every visit, is we reconcile medication. So, hey, you're on a statin. Are you taking it every day? Well, no, I miss some days. Okay, well, let me give you this questionnaire, and let's see if we can figure out what's possibly going on with you missing your medication. And that could be something that they can do while they're waiting for the provider to come in. But I have found it beneficial that if you give it to them and leave them alone, they have a tendency to be more honest and just say, hey, look, I'm gonna leave you alone for a few minutes to fill this out. Please be honest with me so we can best direct your treatment from this point on. And usually they will have a tendency to be that way. But why is this important? This tool allows insight into why the patient is not taking their medication. Is it that they can't remember to take it every day? Is it that the medication is too expensive? Is it that they're having side effects from the medication? Is it that they can't get to the pharmacy to pick up the medication? This is why a tool such as this, specifically the MMAS-8, is beneficial, because it allows the opportunity to tailor the education for the particular need of the patient. So let's talk about the nurse-led education component here. It has been proven that just education alone as a means for increasing medication adherence, that this is unsuccessful. That is why I reviewed the approach of screening for the medication adherence and the cause of the medication adherence, and combining that with the education. It's not been determined what approach to providing this education is best in the clinical setting. It has been shown, however, that when the education is nurse-led and it's completed in person, the success rate is much higher. The combination of in-person education on the part of the nurse would be to address those areas identified as in the screening tool as barriers to the patient's adherence to their statin medication. Look at it as a way to open the door to this communication and allow us opportunities to address their particular concerns and remedy the adherence issues that they're having. Also, ensuring that the patient knows why they need the medication. What is this medication for? Our ultimate goal in preventing future cardiovascular events that could be disastrous. Educate the patient on what these cardiovascular events could be. If you explain to them that we're giving you this medication because we want to prevent a stroke or a heart attack, a lot of the time that will be enough for the light bulb to go off and be like, oh, I didn't realize that's why I was taking it. I thought it was just because my labs looked abnormal. That makes sense. That might be enough just to help them improve their adherence from there. But part of this education should be that specifically regarding statin medications, that you do not necessarily feel the benefits from this medication. It's not like when you take an antidepressant and after a couple weeks to the first month, you can feel the difference in yourself. Or when you take your high blood pressure medication, that when you check your blood pressure, you notice your readings are lower, and hey, I'm not having that daily headache that I was having. You don't feel those benefits from statin medications like you do for the other medications. And explaining to them that our way to monitor this and to see if it's actually working is to check these certain lab levels and why that's important. And a lot of the time, if they know that they're not necessarily supposed to feel better, but that the medication is still working, that will help as far as their adherence. The final factor is to make sure that during this education session that you are combating any possible misinformation that the patient might have gained from well-intentioned family, friends, even internet and television regarding their treatment. I can't tell you the number of patients that I would have that they would say, you know, my friend's neighbor's brother, he was having leg pain. So he stopped his statin medication and his leg pain improved. I don't want to have leg pain, so I just stopped my statin medication so that that wouldn't be an issue. That's not how that works. Make sure you take the time to say, yes, these are certain side effects that you can have from the medication, but it's not necessarily an adverse effect. So educating them on side effects that you can have muscle aches and myalgias with this medication. However, that's not necessarily equivalent with the adverse effect of rhabdomyolysis, which we would need to assess for that in other avenues. And we can determine if this is just a side effect or if we actually need to stop this medication for you. And making sure that they're aware that there are certain things that you'll experience, but let's see how the benefits outweigh the side effects that you're receiving and see if we can better manage and keep you adherent to your medication. Diet and exercise. This is not new information. We are all aware of the benefits of diet and lifestyle modifications to the cardiovascular patient. This is nothing new. However, nurse-led education has been proven to improve outcomes regarding the patient population of dyslipidemia with a visible improvement in their control. Not only that, increasing their adherence to their statin therapy by educating them on these other things that they can do. The research is lacking on the most effective presentation of this education to patients and how best to avoid the bias associated with some of this education. And I think that that could be best done by focusing on the particular changes to improve dyslipidemia and the changes associated with that. That would be the best place to start, keeping it simple. Particularly with their education, make sure that you educate this patient on the fact that we're not expecting you to go and join a gym tomorrow. We're not expecting you to run 3 miles a day every day. No, it could be just as simple as you need to increase your walking. Walk 20 minutes a day, 3 times a week. Let's start there and see how that goes. The other important aspect too is making sure that you are educating them according to what that they can physically tolerate at the time, as well as diet. Make sure that you're targeting those interventions specifically for their diet regarding dyslipidemia. Make sure that they understand that they need to monitor their fat intake, how important that is. Making sure their calories are on target. Make sure that they know that decreasing the sodium content of their diet is going to be super important for overall management of their cardiovascular disease. And again, if we can get overall better control of the disease itself, that in turn helps them to increase their medication compliance and their medication adherence. So the impact of this intervention. I know that everyone is currently thinking, this is all well and good, but who has time? And why should I try to find the time for this? These interventions, singularly, when they're used individually, have been shown to improve medication adherence. Specific to our cardiovascular patients, it's been proven that LDL levels on the patient in the clinic setting have improved with the application of lifestyle modifications and when nurse-led education is provided. Now, keeping in mind that we're talking about patients that aren't adherent to their medications, so they're not necessarily going to be adherent to follow-up the way that they're supposed to. So again, that's just in general the tendency of this patient, keeping in mind that that's a possibility as well. So educate them on the importance of, hey, look, if you can follow these things that I've educated you on, take your medication once a day for maybe the next month, because it's been shown that the appropriate time frame for a follow-up of LDL levels after you complete an intervention with that patient is a minimum of 4 weeks. So, hey, can you come see me again in a month? Let's see where we are. Let's recheck your levels. You should be able, if you do what you're supposed to do, we should see improvement by that amount of time. And a lot of the time the patients can say, hey, I can do anything for a month. Let's try it and see. You follow up with them in 4 weeks, their LDL has improved. That's encouraging to them because again, the statin medications, you don't feel the benefit from this. So if you can see show them proof that this is working, they'll be more adherent to the medication. So keeping in mind that if we set these goals, communicate with the patient regarding the goals, that, hey, this is what I want to see these numbers at, give them a goal to achieve, and that can encourage them to maintain their adherence the way that they need to. So then, as far as our implications to nursing practice, the opportunity to increase patient compliance with medication therapy, it has the potential to not only treat the current condition, which in this case is cardiovascular disease, dyslipidemia, for which the treatment is prescribed, but to also prevent those disastrous future complications associated with this underlying disease of cardiovascular disease. There are several ways this particular avenue of addressing statin compliance can have positive implications on the nursing practice. First and foremost, again, is decreasing the disastrous cardiovascular conditions such as your MI and your stroke that correlate with statin non-adherence. Now, up front, it appears that it will take time away from patient care. How do I justify taking this time away from patient care? However, you have to look at this from a different direction, okay? When a patient is non-adherent with their statins, they run that risk for a major negative cardiovascular outcome. If a heart attack or a stroke were to happen, the nursing management of caring for that patient in direct care during the event, the recovery afterward, and the rehabilitation associated with that recovery exceeds the amount of time it would take to educate them. Again, we've been sitting here talking right now, probably feels like forever, but it's been approximately 18 minutes. So think about that amount of time. Is 18 minutes worth the amount of extra visits, extra medication, extra cost to not only your practice, to the patient themselves and their insurance company, that could be avoided with structuring this type of education and this medication adherence screening? When you compare the two, there's no comparison. To take that couple minutes, it could be as simple as, again, I see you're on a statin medication. Are you taking it every day? No? Why not? Cost too much? Okay, go to the doctor and say, hey, guess what? Can't afford this medication. Can we give him something else? Usually you can find a medication that is much more cost effective and they'll be compliant with it from that point. Is it because they can't get to the pharmacy? That's as simple as possibly setting up a delivery service or finding another avenue to get that medication to them, get it delivered through the mail to their home, to see if we can remedy this. Again, while this particular review that we are focusing mainly here on the effects of this combination of medication adherence screening and nurse-led education to improve statin adherence and in our cardiovascular patients, but the potential success of this type of combination of interventions allows us the opportunity to apply this to other disease management as well. We all have patients who, for whatever reason or not, they're not compliant with their medication. So we can see this as an opportunity to improve overall disease management for our patients in a much broader spectrum. And keeping in mind as well, I mean, we as our practice, we had the overseeing organizations of our practice that we were graded on these metrics regarding how compliant our patients were and how adherent they were to their statin medications in particular, that I would get a list quarterly of my patients that I'd prescribed statin medications to. And hey, these are on the naughty list because they're not picking up their prescriptions. Well, why? So it could be as simple as that allows you the opportunity to target these patients with these particular interventions to not only improve their overall health and their overall outcomes, but the outcomes for your practice overall. And this is an avenue that you can use to reach out to these patients and maybe determine what their adherence is, target the education, and improve what you're doing and improve the metrics for your overall practice. And some of you might be nurses that's your responsibility, is to contact these patients and find out why. Utilize a screening tool to find out why they're not being an adherent and address it and educate these patients and make sure that we're covering all the patients to all the avenues, all the issues, so that we are preventing these possible disastrous and possible terminal outcomes for our patients and improve their overall quality of life. Because again, our goal is to not only treat conditions, but prevent the negative things that could happen. And this allows us the opportunity to do that. So again, I appreciate so much your attention and allowing me the opportunity to present this information to you today. I hope it was helpful. And if nothing else, maybe get your mind thinking as to what you can do in your own practices and in your own patient care to improve these outcomes and improve your patients overall, their health care that you can. That way we can not only benefit our patients, but benefit us in providing the most effective care to our patients. So again, thank you so much for your time. I really appreciate it.